Now to start. And we have begun. So here we are. So let me, oops. I mean, basically, it exhausted this PowerPoint except for two things. And I just think we need to basically look at these things, the imbalances, and the whole idea of heart failure, just to review that because I think it's so important. It's like what goes wrong. And what goes wrong is this. I mean, it's by definition, we call it congestive heart failure. It just means that if the system fills with fluid, it's a fluid, it's a system designed to be moving fluid. It moves that fluid to capillary beds in your lungs, to capillary beds in your body. And if it stops or slows moving for any reason, these capillaries, with very, very rare exceptions, are all permeable. They have little slits and water seeps out. So if it slows down, inevitably the byproduct is fluid leaking. And so what is it does when fluid leaks in an area, whether you have to exchange oxygen or carbon dioxide at the lung level or at the tissue level and waste products and nutrients at the tissue level, it congests it. So it's congestion isn't just like my nose is congested. Congestion implies the inability for exchange to occur, whether it's gaseous or chemical in nature. So, and the circulation therefore becomes inadequate to meet the tissue needs. And so, moreover, the more sluggish it is, the more the liquid is designed to come out. And so, it reflects a lot of things. It's not just because we're doing a heart unit. We talk about the weakened myocardium. I can buy that, but that's not the only reason. I mean, there's kidney failure becomes when I start to see things like that. The whole body is interconnected. Is it the lungs? Is it the heart? Is it the kidneys? Those are the big systems you begin to look at because fluid overloads could come from either of those sources or the lungs being so deteriorated, let's say for somebody who's smoked very, very long term, uh, having, emphysema and having, significant obstructive disease. Pick a reason. So I hope you get the idea of why this is so tragic. Okay. And so that, and if you want to say from a heart perspective, the most common thing is athero. Athero, we call it arteriosclerosis. It's more accurately atheromas are fatty plaques. What happens, whether it's consistent pressure, whether it's hereditary, whether it's something you inflict on yourself with toxins, with cigarettes, without you name it. Okay, there's a lot of reasons why these fatty deposits and sclerosis means hardening. So the fatty deposits harden. And part of we really think it's a very inflammatory process that creates it, and the layer that's impacted in between the smooth muscle of the blood vessel and that delicate simple squamous lining, because under any epithelial tissue there is a layer of loose or real or connective tissue. The collagen in there gets exposed, and that triggers clotting, that triggers inflammatory changes, and that becomes the site for these atheromas to build up eventually. And so generically, we used to call it arteriosclerosis for hardening of the arteries, but this is more accurate. Okay, and whether it's the coronary arteries are doing it, whether there are other factors are involved, but let's say for argument's sake, this is about the heart, so we're looking at coronary, arterial, or atherosclerosis. And once you get contractions, no matter where it is, it's going to lead to failure. It's going to lead to a backup. If the left side fails, basically what happens, it can't pump the fluid to the body, which means it's a plumbing system. It backs up into your lungs. The fluid stays in the lungs, it pushes on those capillaries. You get pulmonary congestion, we call pulmonary edema, fluid in the lungs. Reverse it, okay? If the right side fails, then you have basically the fluid can't get to the lungs efficiently. And what happens is it backs up, and because of gravity, even though we might see it in the upper extremities, it's in the abdomen and lower extremities. We call that peripheral edema. In any event, those inadequacy, and then it sets off a vicious cycle of events. Now, if one side fails, it induces the other side to fail. Because if it's not getting enough, if there's not enough blood coming back, it can't get it to the lungs to oxygenate. Therefore, it can't get a sufficient amount of oxygenated blood to the tissues or to the heart itself, and eventually the left side fails. If you want to think of it the other way, if the left side has already failed, then the right side has to push against all this fluid to try to get the blood. It's going to fail. So in any of those any of those imbalances, one-sided failure inevitably leads to both-sided failure. Things that do it, and this is the tragedy of silent. This is why we call high blood pressure the silent killer. I can't tell you how many patients I had, enough that I can remember several of them off the top of my head. 25 years, relatively young individuals, 30s, 40s, and all of a sudden I hear they had a stroke. And really, these are the individuals who generally don't. I'm not so much about take care of themselves. Maybe they weren't. Maybe they're overweight. Maybe they drank a little too much. Maybe they didn't exercise enough. But the reality was, it was unusual until you found out they had some kind of high blood pressure, and they didn't know it because they didn't go to the doctor regularly. And and it's changed a little bit today because of insurance physicals. It's changed a little bit today because of occupational health things. We're a little more attentive to it, but people didn't realize it, and all of a sudden something tragic will happen, or maybe a tiny blood vessel that's weak in the brain will pop. You may learn about that in the lab if they start. Did they talk about specific blood vessels in the lab yesterday for you folks who have lab? Did you name some of the blood vessels? Did you get to the circle of Willis? Okay, you didn't get to the one in the brain. You talk about the carotids. The internal carotids, common carotid here divides. External carotid is face. Internal carotid goes into your brain. Effectively, that along with the vertebral arteries and the basal arteries. You talk about those. The vertebral basal. Okay, you have a backup system. Carotids here, vertebrals here, and effectively you have 4 vessels feeding into your brain. It's called the circle of Willis. It's what some people erroneously call a roundabout. If I'm from New Jersey, we call them traffic circles. Okay? And what happens is, even if there's a blockage here, you have 3 other ways to get blood there. Okay? What forms in there are something called berry aneurysms. And they're like tiny little berries on this tiny circle of artery, this sort of circular artery that's there. And they burst and it's a massive stroke. We see that a lot with hidden hypertension. And typically men, 30s to 40s, more often of African American descent than not. Typically, and indeed African American descent, we see a predominance of essential or unidentified hypertension. Just saying. Okay, so all of this. So what's happening with high blood pressure? Your heart's pushing against these blood vessels. The blood vessels are taut. That's the bottom number. That's your diastolic. The heart has to work hard. It overexercises. We talked about that with electrocardiography and things like that. You have an enlarged heart. It's an inefficient muscle. Maybe it helps a little going forward, but once that heart reaches a point of no return, now it's effectively too muscle bound to pump efficiently for you long term. And so, if you've had previous heart attacks, if you have a terrible condition called cardiomyopathy, it can be inflammatory from a chronic autoimmune disease. It can be related to drugs. Sometimes we don't have it identified. There's even a viral cause. Typically, those are the things that you end up having to think about heart transplantation more than anything else, if indeed the candidate could survive the procedure. That's a lot of. You have to understand when you start talking about those kinds of procedures, organ transplantation, major surgical procedures, these sort of the hidden substances. Could they possibly survive before you consider doing it? And a lot of times, I mean, it's sad. In my day and age, and if you're familiar with the collectibles industry, everything from baseball cards to toys and things like that, they were brought about by one person, very famous baseball player named Mickey Mantle. He was the original first superstar in the 50s and the early 60s. Basically, his trading cards, if you had one, were worth unbelievable amounts. So they really started the collectible industry. And almost anybody in collectibles would understand that or agree with that. He was a chronic alcoholic. And it worsened with time. He got liver cancer. And his liver failed. And they transplanted him anyway. He died really short. He should never have been transplanted because they knew he had cancer. But because baseball was the biggest sport, and he was the most famous and the most endeared baseball player of them all. Okay, everybody loved him. They transplanted him. It was very, very sad. But the idea is what do you mean? You can't do procedures like that on people who are, and it was never going to survive long term. So this is the idea of the backup and things like that. Another term you're going to see is decompensation. Alert, you nursing students! A famous term. Years ago, this was something nursing instructors love to talk about. Is right-sided heart failure. So right heart failure, because it demonstrates itself, and usually it comes because the lungs are filled with fluid. It's called core, which means heart, pulmonal. File that away in your memory banks. That's those instructors. Don't have to thank me for it. It's part of the service. Core pulmonal. Listen to me when I give you these little hints. I've been teaching nurses for more than 25 years. Future nurses of America. Like I said, married to two of them, not at the same time. Don't look at me. You've heard all that before. You would have been nice, Allie, if you would have smiled. Thank you. Yeah, I say that. So much for that heart unit. On the blood vessels. So tell me, what did you go over in lab so I don't get too terribly redundant? Anybody? Well, okay, you did blood vessels. Did you talk about elastic and conductive arteries and distributing arteries? Pardon me? Ever so briefly. Did you talk about the layers? Where the good. Okay. Which one has the thickest middle layer? Arteries or veins? One of two answers, arteries or veins. Arteries is correct. Which has the thicker tunica externa or outer layer? Veins. Okay. That's a consistent finding. Okay. So this is that's why we call it structure and function, anatomy and physiology, because if you understand the structure, you get a pretty good idea of the function. All those elastic connective tissue in the conducting artery, that rebound thing I went crazy about. Right? There's a reason I do the stuff that I do. It's not just to entertain you or keep me awake. I'm trying to keep you guys awake. I realize it doesn't always work. You notice how our numbers lessen as the week progresses? Okay? So I don't care. You're paying me. If it's an empty room, I'm here. I have to teach you. But it becomes important. And I'm going to make this, and inevitably, when I'm making this kind of a statement, it rarely applies to the people sitting in this room because you're here. Okay? Or somebody like Sydney, that's something important who always shows up. First exam, also in micro, we're a gift. A gift! That's your one shot at extra credit. That was your one shot at extra credit. No more gifts. From now on, serious business. This next exam, don't come and say, oh my God, blah, 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 blah. No, can I do extra credit? Don't want to hear it. I'll respond and say, no extra credit. Thank you. Bye. Please, had your chance. Time has come to get serious. You know, I had a lot of stuff going on in my life. It shouldn't impact you. That's why I threw you the freebie, so to speak. Get it? I mean, you'll find nobody else is as accommodating as I am. Even and maybe Dr. Dresses, because he's the nicest guy in the world. That's about the height. Okay, blood vessels. Okay, arteries away from the heart. We did this. Okay, by definition, veins back to the heart. Again, the flip side is pulmonary and umbilical. And capillaries are where the exchange occurs. The only exceptions to capillary beds that do not have free exchange are two places. The brain, because we talked about the blood-brain barrier in AP1, and in the male, the testicular area. The testicular capillaries, because sperm, as you will learn when we get at the end of the term into repro, okay, are produced after puberty, so your body would recognize them as foreign. So if sperm were exposed to the general circulation, the white blood cells would attack them. That sometimes happens when a man has had traumatic area into the testicular area, or a testicular tumor, that kind of stuff. Okay, that's it. Closed system. What's meant by closed? It's continuous. The heart, the arteries, they get smaller, they get smaller. Eventually, those little openings, I don't know why they put that there necessarily, but this is the area where there's exchange. Those little things don't mean anything. And the same thing coming back here. I don't know why that's part of this. But what you will see, this is an open system. The lymphatics, which are a companion system to the veins. As you'll learn in a subsequent chapter that we get to after this chapter, that the lymphatics carry heavier fluids, fatty fluids, proteinaceous fluids that effectively, for lack of a better way to describe it, are too thick to fit into the capillaries and would clog them, and basically are carried back by a separate system. And these are lymph nodes, what we call swollen glands when they're inflamed. And unfortunately, bacteria and viruses utilize this as a passageway. Cancer cells utilize this. So it's a very important system we will get to. And basically, it dumps all of its stuff eventually, typically around the superior vena cava. So it waits till the products are processed to some extent and into a blood vessel that can handle it. Okay, if you want to view this, you want to view the circuit. That's meant by open. This is open-ended. Those are open-ended vessels into the tissue spaces and picking up these interesting materials. The blood, the plasma, all continuous in nature. 3 layers. The old terms, you can describe any way you want. The intima is continuous with the lining of the heart. Simple squamous endothelium. How many times do I have to do that stupid thing with my, that I do? So it's nice and smooth, continuous. No bumps, no lumps. The media, the mid layer, mostly muscle, and obviously, as you did or will learn about in anatomy, the fact that you have a certain amount of elasticity, particularly so in the arteries, much less so in the veins, and the external, basically a fibrous outer layer that, as you will come to learn, is thicker in the veins. And the reason it has that support, veins are what are known as capacitance vessel. They can get bigger without bursting. Arteries, not so easy to do that. Arteries don't function as well when they're overloaded. Veins are designed. You see it all the time. Whenever they put a tourniquet on you to take blood, just hold it, clamp one off and start pumping. It'll fill up. You can see them. I can see them. Anybody can see them. Thankfully, I have easy veins to hit. And so the lining is endothelium, and capillaries, as you will learn, have nothing to do with those layers. Capillaries are effectively lining cells that have sort of created into a tubular structure. One here, one next to it, and sort of like spiraling along. All it is lining cells, period. There's no medium layer, there's no outer layer. Very unique vessels, and they're all about stuff coming in, stuff going out. Okay. The intimate contact with the blood, lining, simple squamous, continues the endocardium, friction, that's the whole, I'll do it again if you want. And then underneath any lining cell, there's always a little bit, as I was saying before, loose areolar connective tissue. Typically, you only see that, again, larger than a millimeter. At a millimeter, figure anything you can't see with the naked eye probably has lost that or most of that kind of tissue. That's there. The media, smooth muscle and elastin, you know the distribution. We're going to look at it. And that's because that's where they open and close. A lot of this particular unit is how we distribute the blood. I'm reviewing the anatomy. We're going to focus on the physiology aspects of it. Be happy. I got a sudden bolt of energy. I don't know why. I didn't think I'd have it this morning. And so we can either constrict or dilate. We can either limit flow or open flow. And that's how we redirect it. Remember fight or flight? We're going to put it to the heart and skeletal muscles. This is how it works, by altering blood flow. Okay, and blood flow and blood pressures. You can see the externa, sometimes called the adventitia. Without getting into fun, I'll skip that point about adventitia for now. Okay, collagen fibers, reinforced, anchoring it. Adventitious generally anchors to surrounding structures. That's not always the case with some of these, so I don't want to get into it. Yes, elastic fibers, that's to give them that ability to stretch as capacitance vessels. And when you see the term vasa vasorum, it means vessels to vessels. I mean, some of these vessels, the aorta, the vena cava, pick up, they're pretty darn big. So you have to have blood vessels that supply their muscular structures with oxygen. So vessels leading to vessels, vasa vasorum. And they basically nourish that outermost layer. And it's a great, you see this a number of times. When you dissected the heart, the reason you could tell the pulmonary trunk and the aorta was because they stayed open. Fancy term that we use for open now is called patent. It looks like patent, but it's patent. It's an important word. Okay. For any of you going in a clinical career, patency is an important word. So when it's like having an open airway. You want a patent airway. And so you can see, look at all that elastic connective tissue. So there's a big conducting artery. Veins, even though it appears kind of squished here and on the heart, why they typically were difficult to find when you dissect the heart, interestingly enough, they're very stretchy. Very stretchy. And so to me, this is a wonderful, here, very easily. This is the capillary. It's just lining cells, maybe with a little bit of protein-based basement membrane. But you can see the distinction. In arteries, typically, universally, you're going to have a thicker media or middle layer than to veins, but the veins are going to have a thicker external layer than the arteries. So if you review this, it's really a good slide. The lining is the lining. The intima is the same. Okay? You're going to see in arteries, look at the difference. They have an internal elastic membrane here. They have an external elastic membrane here in the media. You see very little in the way of elasticity here. Notice, elastic here, not a whole lot. The stretchiness kind of comes from the looseness of the collagen fibers in the externa, and perhaps there's some elastic tissue that's in some of the larger ones. And they get progressively smaller and smaller, and this is a typical artist's rendering of a capillary network. By the time you're here, these tiny vessels are called arterioles. Again, the diminutive suffix. After the capillary bed, you have venules, and there's certain exceptions. You learned about one in endocrine, where you have a capillary bed going into a vein, and then another capillary bed. It's a PORTAL system. We find one in the pituitary from posterior to anterior pituitary, and you're going to see one in the liver, coming from the digestive tract. So here you can look at this. I mean, I love the slide myself from a teaching standpoint. This is the big deal. Look at the size of, when you start looking at the diameter here, and the diameter here, and you see how 1.5 centimeters, that's the diameter interior, more than a half an inch. Okay, just about 1/4 of an inch in one of those muscular arteries, like where you take your pulse. But when you get to the arterioles, and basically you can't see them, that's typically what the suffix means. Look at all the muscle. Why is that important physiologically? That's where you control your blood pressure. That's where you control distribution. The arterioles are where basically blood pressure is made, because these vessels are big and thick. Okay, you have to, in order to stop blood from going through them, you can't do that very easily. I mean, you can't even put a regular tourniquet. You can't take, like they do in the movies, take a belt material and put a tourniquet on that. Will it help? Sure. Is it going to stop the blood flow completely? No way, Jose. Okay. It takes a tourniquet here at the thigh between 350 to 500 millimeters of mercury. Ain't no way you're going to put a tourniquet on that effectively. Maybe here it's about 250 millimeters of mercury when you get down here to the ankle. About 250 to 300 up here. I spent nearly 30 years doing surgery under tourniquets, upper and lower extremity when I was a student and a resident, and lower extremity when I was practicing. No tourniquets. Another one of my areas of research. Don't think. You don't have to know anything about it. So you can see this. Look at the proportionality here. But the difference is here, that lumen, the opening. You can overcome it. I mean, I can take it, I can squeeze it, close it. Not so much here. Capillaries, notice, elastic tissue, smooth muscle, fibrous, collagenous tissue, none need apply. And as you can see, the lining is always the lining. Okay, that's there. Venules, again, no elastic tissue. Once you get to a vein, there's a trace amount, but as always, the external is thicker. The groupings, elastic arteries, thick-walled, wide lumens, that makes them low resistant. Another name is conducting. We spent entirely enough time on the rebound phenomena, blah, 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 blah. So these don't involve vasoconstriction. They have to, it's that elastic connective tissue keeps them open. It's not that they're not fraught with problems. One of the things they keep telling me to have done, but I refuse to pay for it. When you get to a certain age, it's called screening for an abdominal aortic aneurysm. Anybody know what an aneurysm is? I'll explain for those who don't know. It's like a bubble in a tire. You ever see, you maybe have a bike tire and all of a sudden you see it bulging out? We see this a lot. Okay. The abdominal aorta is an area, unfortunately, which will weaken in certain individuals, particularly as they get older, and you have to look for it because if it bursts, usually it's fatal. And effectively, when they have something like that, the procedure is once you identify it, to prevent it. That means you go in and you kind of oversew the aneurysm, kind of push it back in and oversew it. It's like an outpouching of an interior layer, and then you put like a sleeve around it, external, to reinforce it. Like a girdle type of a sleeve. Do you use girdles today? I'm from a different age. I'm sorry. Only in my anatomy and physiology class do we talk about previous generations' undergarments. That was just me, a slip of the tongue. Slip. Half slip. The next thing I was going to say, don't be petty. Oh, come on. You couldn't get 4 quick puns like that from just anybody. You're not. You're in trouble, Allie. She's ignoring me. Okay, enough. Expand and recoil. Muscular, distributing. The named arteries, with the exception of things like the aorta, the pulmonary arteries and pulmonic trunk, as it were, carotid, subclavian. After that, okay, brachiocephalic, another one, which is just a little in between. They deliver, okay, pinky finger to pencil lead. So they're much smaller than you think. I mean, so the radial artery, the easiest pulse in the world to get, at best, 1/4 to 1/8 of an inch. Named arteries, thickest media, more smooth muscle, less elastic. Okay, there's those little membranes. They do vasoconstriction, and finally arterioles. Okay, all three. And as you can see, as they get smaller, you have less smooth muscle that's there. And we call them resistance because that's how you change the diameter. You can open and close them more efficiently than anything else. And they go to capillary beds. The capillary beds are, again, very thin, intima. One cell forms a circumference, maybe a little external. You might get these stem type cells that stabilize it. You may open and close it a little bit. Okay, and every single cell derives its nourishment from ones that do not have a blood supply. They get it by diffusion. That is cartilage, epithelium. Remember epithelial, all those epithelials you studied in AP1. Simple squamous, stratified squamous, simple cuboidal, blah, 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 blah. All of those were sitting on top of loose areolar connective tissue and The nourishment came, the nutrition and nourishment, the oxygen carbon dioxide exchange came indirectly by diffusion. Same for cartilage, same for the cornea, same for the lens. That's why post-mortem they cloud up. When you were doing the eye dissection, that wasn't, you didn't have a see-through lens, did you? No. Now you got why. And they're all about exchange without those limitations. There are three types. Did you do 3 types of capillaries? Yes. It's like this. I think I showed you this one. Hello. It's like you were a little kid and you didn't have a cup for water and they had like a spigot. Okay. You put your fingers under there at the playground, ours like that. We didn't even have Amazon water fountain didn't work. You have that, you hold it in your, and you drink that way. The water didn't stay in there very long because there's little tiny clefts. That's the standard continuous capillary. It has permeability to water, but other than those 2 areas, or water soluble things, brain and the male testicular area. Okay. When you get to the kidney, it has larger openings and special little openings called fenestrations. A fenestration is another name for a window. When you go into a clinical environment or operating room, we use these all the time. They're called fenestrated drapes. Basically, you open a sterile towel, and it's got a big hole in the middle. Very useful. You're working on a knee. You put the drape there. There's the hole. Clamp it here. Clamp it here. You have a nice feel to work on. Fenestrated drapes. Fenestration is a window or a hole. And when you get to the liver, they're called sinusoidal because their openings are huge. So the ones, the fenestrations in the kidney are for filtration. Job one by the kidney. Filtering out something called filtrate, that we reclaim some, we get rid of stuff and keep things in balance. We're doing that toward the latter part of the term. The liver, all that undigested food that you just got starting to process, and the liver does the rest of it. It's got to get rid of toxins. It's got to make proteins. It's got all this stuff to do. So those are large things that go through, and they kind of, the term I will use when we get to digestion, they sort of percolate through the liver. You know what a coffee percolator is? Maybe you've seen. If you ever go to, like a fair or wedding reception, something like that, big party, and you get coffee from those big urns, they're called percolators. And typically, they make it like electric coffee pots. Like around here, they just make it and they carry the coffee and put it in. They cater for us over at the event center. A little different. I'm talking about stuff from ages ago. Mostly everyone. These outer cells called pericytes, they will open and close those clefts depending. Brain don't have the clefts. They have tight junctions. And remember the blood-brain barrier, they're surrounded by astrocytes. Ringing a bell? I asked that as a test question on the final. See? There's a method. Nobody listens to me. Fenestrates. I love the Swiss cheese analogy. And they have, and basically here are those fenestrations. Again, mostly kidney, sometimes glandular areas, and sinusoidal, big clefts, large lumens, liver, bone marrow, spleen. This is where there's a lot of flow, and we're trying to, filter's the wrong term, we're trying to allow large elements like red cells, platelets, again, to pass through. It's really important. Very sluggish, large molecules and cells can pass between, and inside of them, inevitably, there's a lot of, this is where we trap invaders. This plays a very significant role when we start looking at immune system. Okay, and after this, and after a little introduction about the lymphatic system, which takes about one period, we hit the immune system. That's part, this is the third unit. Third unit is blood vessels and lymphatics, which are together, and immune. And immune is the hardest unit we have. Is the message being understood? What?
Wait, so you said vessels are on the third test then?
Blood vessels are. This is not on. This is not on the test.
This isn't on this test. Oh.
Would you like me to put it on? I would give you a hard time. No, it's not on there. I promise. It's a freaking 2-chapter test, right? It's got blood, Okay, and it's got the heart. 2 chapters. What? 2 chapters. It's okay. Oh, you should grab more money. My wife is in such a trying to make a deposit at the bank, and the line was out the door. They had no idea what they were doing. Oh, she was trying to make it because we didn't have it. We had mislaid her, her ATM card, and she, oh God, I came back and saw her Monday afternoon, fuming. She had a lot of creative usage of the F word, nouns, verbs, adjectives, the occasional adverb. You know, she was unhappy camper. You know why I was not mad about that? She wasn't directing it at me. As long as she's mad at somebody else, I'm happy. Moving on. So this we call it the microcirculation. Typically, there's an arteriole that leads directly into the capillary bed. There's usually a handful of them, as you can see. Okay, and then there's a venial that captures it. So it really the flow is controlled by that arteriole going in, and there's all sorts of things that do it. Okay, when we need blood, we need oxygen, etc., and they'll move it away. So we have a neat system, very neat system of directing our resources where they're needed. So things that do not have enough nutrition or enough oxygen goes there. If they have an abundance of waste products, if they're overused, it goes there. Okay, it's just the way it works. Okay, and they're trying to show it to you. So if it's functioning, it will go through, and it'll perfuse. Again, that is the term. It'll supply that capillary bed with circulation to provide exchange, nutrition, waste products, oxygen, carbon dioxide, and if not, it'll bypass it. This is a typical capillary bed, whether it's dilated, open, or constricted closed. We have other things. Now, when we get to the intestines, it's a little bit different. We have shunts. Okay, so it bypasses the capillaries. And another name we give them is meta-arterioles and thoroughfare channels. And they're controlled by a little round bit of skeletal muscle called a precapillary sphincter. A sphincter is just that. Okay, it's just a piece of muscle that's typically encircling either closed and opening or open and opening, as it were. So, and local chemical conditions. It's not nerves. I mean, these are chemical. We don't control these. Could we have something that we could take from a medication or a drug standpoint? Possibly. But here's what it is when it is closed, these sphincters are closed, it doesn't get through there, so it creates effectively a bypass or a shunt. Okay. There's nothing unusual about those. And sometimes when we require it, we utilize them. And again, it's the uniqueness of the blood supply to be able to redirect it where it's needed. And now we get to the flip side of it. My area that I like so much, fair warning, veins, okay, at the end of a capillary bed, venules, you can see them, and veins. So a lot of capillaries form these venules. And again, these post-capillary venules, there's not a lot to them, very porous. Lots of stuff are coming into those capillaries as they're approaching the venous side. And even as you get larger, there's not a whole lot of smooth muscle to them. Venules converge. I was trying to show that to you before. There's a lot of tributaries. When you start to talk about veins anatomically, for instance, you have 2 large veins that service the skin here. One goes up on the thumb side and one goes up on the pinky side. You're going to learn about them, or I'll tell you about them a little bit, but you probably should learn their names. This one is called cephalic, because it's up on your head. You hold your arms like this. This is basilic. They're big veins. And we'll talk about the venous system. But there's multiple feeders that are in there. That's why you'll see when you learn how to do, many of you, how to start IVs, you have to be careful. And typically you start farther away and you begin to, there's different techniques because you have to keep resticking the patient. Eventually those veins get damaged and they have to do what's called recanalize. They have to reopen. You're not permanently destroying them, hopefully not. But it would be very unlikely. When I was very, very ill, almost 20, 25 years ago, at least 25 years ago, my arms were black from being stuck so many times. Black. Not black. I've been for a long time. Perfectly normal, like nothing happened. But they were completely black. I mean, they were doing bloods 3 times a day. I had IVs sticking out 2 or 3 at a time. Oh, I was physically sick. The mental sick has been there for the duration. She likes one person. She and my sister share the same person. She's special. So I'll start this another time. Don't give me a hard time. 4 hours. So capacitance vessels, because they stretch 65%. Same illustration. Really good slide to teach with. We're so excited. Oh my God, clogged arteries. Take a look. Only 15% of your blood is in the arteries at any one time on average. Only 8% in your heart, only 5% in your capillaries, going to your lung about 12%. Everything else, guess what? Veins. So we de-emphasize the veins. It's not just because of my passion about them. Okay, it's because a vast amount of the blood's in there. We need to be more respectful of them, and we are not necessarily. And you will learn a whole lot of stuff that we do clinically to deal with veins that are there. And so they don't offer a lot of resistance, so they have certain adaptations to allow the blood back to the heart. Number one on the hit parade, many of them have valves. Just those cup-like structures they're going to show you, just like we saw in the heart, except they're designed basically like this, and here are these cups are sort of like this, here and here at intervals. And so as long as we're pumping them, it pushes the blood that way. When you stop and just stand, as I'm doing now, effectively, those cups come together. And so the fact that you just pump the blood up 3 sections, it doesn't go back down with gravity. Like every time you walk, I just pump the blood up to here and I stop. The valves, very important. Diseases with valves, damage to valves, you hear about people with varicose veins, it's one of the reasons. So they prevent backflow. And we see them vast majority. As the big vessels like the vena cava, superior and inferior, they don't have them. But in the extremity, the arms and the legs, an abundance of them. You're going to see areas in certain that have venous sinuses. You saw one on the heart, the coronary sinus. A flattened, widened area is known as a sinus. We have them in the brain. But the big problem we have with them and where blood clots emanate from them is back here in the soleal. They're called soleal sinusoids. That's when you hear about blood clots leading to pulmonary emboli, and you will. Okay? And you'll see with them and you'll see how we deal with them. Basically, they come from back here. That's why we mentioned it in a couple of clips, why they have those squeezing devices called intermittent compression devices for people who have to stay in bed for long periods of time. Why we want people to get up and walk around as much as possible. That day, the next day, little old ladies, 90 plus years old with a hip replacement, they're sitting in a chair the day of surgery. They're down in PT learning how to go with a walker the next day. They're going home that day. Okay, so the coronary sinus, the heart, the dural sinus is the brain, and the soleal sinus is a big player for blood clots. Same illustration. Leaky painful valves contribute heredity, obesity, people who stand for a long period of time. Let me see. Could that be a nurse? Yes. You'll learn. Foot gear is very important. Very important. Okay. Obesity, pregnancy is often a contributing factor. affects more than 15% of adults, more than you would think. Okay, and even this is something which you don't see with as many people, which to some extent happens with aging over time. So varicosity in the anal veins, we call it hemorrhoids. They can be a real problem. They burst because you lose a lot of blood. And there's a lot. We talked about collateral channels. We see a lot of those to ensure flow, heart particularly, brain, a lot of areas. So that we've been arranged for that. We don't have to do this. And we'll call it a slideshow. Don't have to thank me. We even got done a few minutes early.